welcome again to our next session of our grant writing series. We're well on our way through this, about halfway through at this point, and working our way towards our October 14th mock review, which I promise you will be getting some information about how to make your travel arrangements to DC for that probably by Monday or Tuesday at the latest of next week. Wanted to also let you know that we are very happy to have Dr. Jerry Donnenberg today that is going to talk to us about, this says intervention and control condition. That was last week. Actually, we'll be talking about significance and innovation this week. So sorry, I was making changes to the slides this morning and forgot to change the title. So we are doing significance and innovation today. Intervention and control was, of course, Seth Couchman last week. And a couple of you have sent questions to me about that you wanted me to forward on to Dr. Couchman, and I will forward those on to him and see if we can get some responses, because there were some good questions there. So before we bring Dr. Donnenberg on, I wanted to take a moment to go over the homework from last time and see if there are any questions at all about the reading. I think the reading that you were going to do for this particular session was Chapter 16, which was using technology and the internet and research, which may or may not necessarily be relevant to your particular, the work that you're doing, your particular intervention or your particular research study. But I just want to see if there were any questions or concerns that came up out of that reading, if there's anything that you want to talk about in terms of it, and we can say a little bit more about that. But if you do have any questions about it, go ahead and raise your hand and we can discuss it now. Nothing out of the reading. Great. Hao Chu, I'm going to unmute you. Go ahead.
Hello.
Hi.
Hello, can you hear me? Yes. My question is that, internet-based research becoming more and more popular now. And I hope that Dr. Gary can explain more about the advantage and disadvantage about internet-based interventions. Thank you.
Thank you, Hao Chu. What I'm going to encourage you to do, Hao Chu, is hold on that question. Dr. Donnenberg may be able to answer some of those questions, but I think one of the people that we're going to have a little bit later, in a couple of sessions down the line, which will really be able to answer this question thoroughly, is Dr. Simon Rosser, and he is one of the experts on internet, the use of internet in research, both from an ethics perspective, from a recruiting perspective, and from an intervention perspective. He really is one of the go-to people on using the internet in research. So hang on to that, because we're definitely going to get there.
Okay, thank you.
Thanks. So I don't see any other questions, and like I said, we are going to devote an entire session with Dr. Simon Rosser, who I think you all will really enjoy. I encourage you to, if it looks like something might possibly get in the way of you attending that particular session, that you do your best to be there. I'm not recalling exactly. I can tell you by the end of today which session that'll be, but I don't have that information up on my screen right now, and if I move too many things around, it causes problems. So let's go into the homework, and I'd like to call on just a couple of people randomly to talk about their intervention and anything that you started constructing out of the conversation that we had with Dr. Couchman last week. If anything that he said that helped you along the way, any challenges that you're having, and how that component of your grant application is coming along. So I'm just going to call on somebody at random. I think Jonathan, I'm going to unmute you and ask you to talk to us a little bit about your intervention, the treatment and control conditions, and how it's coming along. Jonathan, are you there?
Can you hear me?
Yeah. And I just sent you a video request.
Okay. I don't have an intervention.
Okay.
For my proposed study.
So what? Tell us a little bit about your proposed study and what you're doing.
Well, my proposed study is a daily diary study looking at the ways in which daily spirituality influences PrEP use, PrEP adherence.
Okay. And do you have some hypotheses around that?
I do. So I believe that higher levels of daily spirituality will influence next day PrEP adherence. And so I also think that, you know, I could also see where it could also negatively influence it. So really it's more like an exploratory study. So trying to figure out which way it's going to go. But because, I mean, in like non-sexual minority populations, we've seen that like it can influence medication adherence for the better. But since I'm looking at it specifically in Black same-gender loving men, I know that given the homonegative context of religion, which spirituality is related to, it could be negative. So I'm really looking to see which way it's going to go.
Okay, so so it's largely an exploratory and descriptive study. I want to maybe bring Dave Martin and Jerry in on this to kind of help us with the discussion a little bit. But were you on the call with Seth last week?
Yes.
Did he talk about anything that kind of shaped how you're looking at your particular research study, and did you work on, because this is an intervention of sorts, you just don't know exactly how it's going to turn out, right? They're going to be doing diaries.
Right.
Right.
Right. But it's more, like I said, more like looking at the association between those things, and not necessarily, I'm not looking at the diary itself as an intervention, but more as a methodology.
Okay.
Jonathan, can you hear me? This is Jerry Donenberg.
Yes.
Hi. I think it's a really interesting study. I think what you're suggesting is that there may be mediators that influence whether spirituality improves adherence or reduces adherence, right?
Yes.
Is that kind of what you're saying? So what kinds of mediators do you think will be important? In terms of spirit, I mean, one is, well, go ahead, I'm sorry.
No, I definitely think internalized homonegativity would be an important mediator. Given you know, whether the people's spirituality is taken in the context of homonegative context or a more same-sex affirming context. So I think internalized homonegativity could be one of those possible mediators.
So that would be more if they have significant internalized negativity, then they're less likely to adhere. That would be your hypothesis?
Right.
Yeah, it almost sounds like
I'm sorry?
It almost sounds like a moderator effect. If it may change the outcome one direction or another rather than being a mechanism for the outcome, right?
I guess you could say that. Yeah,
I don't know.
Because you're not entirely sure what direction the outcome will go, right?
Right. I'm not sure what direction it will go.
But you want to have hypotheses about that. You want to be able to propose some hypotheses, even if it's exploratory, that you think that, you know, high internalized homonegativity would lead to less adherence, whereas strong sense of self-esteem or something would be less likely, right?
Right. So I'm still thinking through all of those things with my mentor. I have some ideas. I've created a model that I'm thinking about, but I don't have anything concrete right now.
So when you say you've created a model, have you got your boxes laid out with the appropriate arrows going in the directions that you're thinking?
I do. I don't have it up in front of me right now, so can't really talk about it a lot, just because it's something that's kind of like okay, to be completely honest, I've just moved to a new town to start a faculty position, so like my study hasn't been like in the forefront of my brain right now, but it is something I'm working on, but just not this week.
Well, congratulations. I was unaware of your move, so that's excellent. And I think you're headed in the right direction. So hopefully you're working with your mentor, right? And kind of,
I am. Yes, Leo is very helpful.
Good. Dave, did you want to add anything to this discussion?
No, I mean, I'm still not getting a real good feel for where he's looking to go with this either. So I think one of the things that will be important is to sort of tie things down a little bit more as you move forward.
Okay.
And I think developing that model with the boxes and arrows will really help you lay that out. And
there is some background for this that comes out of some of the earlier AIDS research. A guy by the name, I think it was Steven Schwartzberg, did a dissertation on reactions to, back then it was an AIDS diagnosis, but it was tied up in spirituality and self-esteem and that might provide some additional background in terms of where you might go looking at this issue of adherence for people who are currently, HIV positive but don't have an AIDS diagnosis. I think it's easy to forget that, just because things have gotten a lot better today than they were 30 years ago or 20 years ago, that there aren't lessons to be learned from that literature still.
And also, I just want to say that both Seth Kalichman and Jim Jacquard, which was, Jim was at our session 6, and I can get you the link to that session, discuss the issues of modeling and how to really kind of lay these issues out very well. And Jim actually recommended, he put a plug in for his own book, which has gotten great reviews, and I can send you that link if you're interested. The Cyber Mentors program will pay for it if you want to buy it, if that would help you move along in developing your model and everything.
Okay, yes, that would be helpful.
Okay, I'm going to write myself a note to send you that information. Were you on the session that Jim did?
I was. I've attended all of these sessions.
Okay, good. So I will. I'll send you that information.
Okay.
Thanks for putting yourself out there.
Thank you.
All right, let's see how we are on time. Let's see if we can get maybe one other person to talk about their model and how they're coming along with it. Mariana, I'm going to call on you. I just unmuted you, and I'm going to put you up on to send you a video request. Mariana, are you there?
Yes, can you see me?
Yeah, hi. Good to see you.
Hi. Good to see you. So I have been working on this, and I think I have so many arrows. There are too many. And I think one of the things that I'm struggling with is I have a lot of experience, practical experience in the area that I'm interested in, food insecurity, but I am a qualitative researcher, and I'm trying to think more conceptually about these mediators and moderators and, controlling for things, and so it's just a little bit outside of my box, but I'm trying. So I'm interested in the role of food insecurity as it is a predictor of outcomes along the treatment cascade following diagnosis. And so I know that there are a lot of associational studies that show that along each stage of the treatment cascade, there's an association between food insecurity and people not making their medical appointments or taking their meds or not achieving viral suppression. So what I would like to do is come up with an intervention design where we can pilot test the provision of food assistance at really basically at the time of diagnosis that would follow a patient along for the first year or two, depending on how much time I have. Feasible to provide assistance each month, and then try to determine if that enhances retention and care. So I would have a treatment group that would get food assistance, and then I would have a control group that basically just gets the standard of care, which would be here's a list of places where you can go and get food in the community. So I'm kind of struggling with how do I really make a control condition a control condition? And I've talked to a couple of people and that have done similar types of studies not related to HIV, and they recommend giving the control a dollar amount that's the same amount compared to the food basket. But I don't really know if that's the best approach. And then in terms of really how these factors are related, I feel like I have all these different outcome variables along the treatment cascade of making appointments, taking your meds, achieving viral load suppression, but I'm thinking that food security might work differently to link those things together.
So I don't know very much about the issue of food security as it relates to retention and care or treatment adherence or any of those kinds of outcome variables. But it does strike me that food insecurity might be an outcome itself. In other words, there may be other things that are contributing to the food insecurity. And so I guess one of my questions would be, in listening to you, whether you think that it's the food insecurity itself or whether that is some sort of a mediating factor behind, that sort of follows other psychosocial difficulties that your population's encountering.
Yes, and that's actually kind of how I have my arrows, is that food security, might, directly affect, having something to physically make, the meds actually be more tolerant and, not upset the stomach. But also food security or food insecurity is a proxy variable for mental distress and, other elements of instability in your life, such as poor housing. So just really trying to untangle that relationship to figure out what is the best kind of intervention for people who are food insecure, because we know at least that condition, whatever it's representing, is not good for enhancing treatment outcomes.
Well, there are multiple reasons. There are multiple causes of food insecurity. I mean, if you're in a food desert, which is characteristic of a lot of inner city areas, it's hard to get food. I mean, regardless of whether you have the means to purchase it or not. So I can see that you've got your hands full in terms of trying to sort stuff out and narrow things down to, something that you can look at individually.
I think that's a very good point. If they can't get to food in the first place, having a control condition with the money situation dealt with may or may not really address the issue. Interesting.
Well, then I'm thinking, well, if I am giving them this $40 or whatever that's a gift card, they could go out and buy food with it. So is that really a control condition if both groups are getting more access to food? So that's kind of why I didn't like the idea of giving the control group, a gift card to spend wherever, because then they could technically be getting my intervention themselves.
Yeah, I think, when I think about control, I think about the control condition essentially having everything the same as the treatment condition, except the active ingredient that you think is going to make the difference. So maybe that's one way to think about it. Jerry, what's your thought on this?
I was muted. I think it's an interesting question. I'm having a little bit of a hard time conceptualizing why food insecurity, how it would differentially impact each stage of the treatment cascade. Mm-hmm. I do understand it could impact adherence to medications, and that if you're hungry and taking the medications makes you have a stomach ache and you can't, if you don't eat. So I would be clearer about why you really think food insecurity impacts each stage of the treatment cascade. And then if you decide you still believe that it does, you want to make a pretty good argument for how that would look different at each stage. In terms of I think the trouble with the intervention potentially is you don't know how they'll spend the $40, right?
Right. So for the intervention, they would get food. They would actually get, they would get food. So I know that they would be getting food. It's just the control group of how to keep all conditions equitable. And another, PhD researcher recommended that I do a $40 gift card that could be spent on anything for a control group. And that just didn't make sense to me because they could still go out and buy food.
So how will the intervention, when you say they'll get food, what does that look like? Is that ongoing? Is that once? Is that?
I was thinking we have a program in Tulsa that just really hasn't been evaluated or anything in terms of this context, and they get a monthly food subsidy where they can get a certain combination of food items that's of a $40 amount. And so the program right now, you go and get the food, but we could look at maybe some other type of a way to make sure they could get the packages either sent to them or pick them up at some location. I haven't worked that part out yet. That's why I'm thinking study.
You could give your control group something else other than food, spend the same amount of money on them, give them something like toilet paper or cleaning supplies or something. I would do maybe, given your experience with qualitative research, maybe you want to do a little, focus group with folks about what else could they use that would be useful to them that's not food. So it may be laundry detergent if they have a machine, or, it could be any number of things, so that you're spending the same amount of money on folks, but you're really providing different resources, and you could test whether food is the key.
I love that idea. Thank you.
There is some, I seem to remember that there is some research. It's not directly related to HIV, but it is related to this issue of socioeconomic class and its impact on various things in one's life. But I seem to remember one or two studies that have suggested that just giving people money to get by actually gives them a greater sense of control, and the outcomes are actually better regardless of what they end up spending them on. And actually, contrary to what a lot of folks might expect, they actually are pretty smart about how they spend their money.
Mm-hmm.
So it's, I guess, one interesting observation about comparing giving people a food basket with $40 worth of groceries in it and giving them $40, you might actually end up with a situation in which you find that the people who get the $40 actually do better than the people who get the food.
Interesting. Well, great. Great conversation. I thank you for Mariana, for putting your work out there. We appreciate it, and sharing with us. I hope this was a helpful conversation.
What? Yes.
And I got I'll forward your question on to Seth as well.
Okay.
All right. Well, it's closing in on 2:30, and that's usually when I begin to hand things over to the presenter. So, Jerry, we are delighted to have you with us today. We talked about you sending me a bio, and I didn't get it from you, so I'm going to let you introduce yourself. We were doing other stuff up until the last minute, so I'm going to hand over control to you. And once again, thank you so much for covering the significance of intervention components today. We're delighted to have you, and I'm really excited to hear you talk because I've looked at the slides, and I think this is going to be great. So thank you.
It's my pleasure. Thank you for having me. Let's see, I am currently the Associate Dean of Research in the School of Public Health. I'm also a professor in the Department of Medicine, and I run a couple of programs. One is called the Community Outreach Intervention Projects, and one is called the Healthy Youth Program. And I'm happy to talk about those at some point if anyone's interested. I was trained as a clinical psychologist at UCLA following my undergrad at University of Michigan. And my first position was at Northwestern University, where I was in the medical school. I led kind of a child and adolescent program to get the PhD within the medical school, clinical program. And then I moved over to the University of Illinois at Chicago and was in the Department of Psychiatry for many years. And now I'm moved over to the Department of Medicine, just a better fit for me there at this point. So I have had, fortunately, NIH funding for probably almost 20 years, many R01s, probably PI of about 9 or 10, co-PI or co-I on probably another 10 or 11. And I have been doing work in the area of HIV since about 1998. I think my first grant was funded in 1999. I submitted my grant proposal and delivered my first child. So that was pretty good all at the same time. So I think if anyone has any questions, please don't hesitate to interrupt throughout the talk. I'm going to tell you a little bit about, talk a little bit about significance and innovation, but just to, caution everybody that this is not an exhaustive presentation, and as I'm sure all of you have learned over the course of however many years you've been doing this, rules and regulations are constantly changing. So for example, now you have to address scientific premise and research rigor, and the BioSketch format has changed. So keep in mind that I'm going to present what is true today from what I know, but make sure that you're always on top of what the most current requirements are.
By the way,
Sorry.
I'm going to say if people have questions during your presentation, if they just raise their hand, I'll call on them, or if they want to put it in the chat box, we can also deal with it that way. But just want to remind people that I'll call on them if they raise their hand.
Great, thank you. And please don't hesitate to do that. So this is just a little bit of an overview. I'm getting used to this. So we already did the homework review. I'm going to talk about 4 general areas. What do you need when you're applying for grants with regard to significance and in general? We're going to talk a little bit about significance and innovation, and we're going to do a couple of polls to engage you in doing some of the scoring as if you were reviewers. And then I'm going to talk a little bit about some general tips related to writing the grant. So some of this I culled from the internet from other people who've given some talks about grant writing, and some of this I've developed on my own and through my own experience. And I have experience with R01s, I have experience with R34s, R03s, and R21s. And so feel free, if any of you are thinking of those mechanisms, to shoot some questions my way. So the first thing you really need are good ideas. And there are lots of good ideas out there, and you shouldn't hesitate to sort of ask people what they think about those good ideas. But it's pretty straightforward, and you can have just as good ideas as even senior people, and probably better ideas. I think one of the reasons there's a lot of emphasis now on the next generation, meaning you, as scientists, is because we're sort of old and we are running out of as many good ideas as you guys bring all this new information to the field. So be confident about that. And then the second thing is to write very clearly. And sometimes that means that you have to get people to review your writing, give you critical feedback. Don't be shy. I love getting critical feedback from my senior colleagues who take a look at my grant and this isn't clear and this needs to be said more in a more straightforward way, or you don't need 20 sentences to say this one comment, and especially now that you only have 12 pages and most of what you want to really focus is on the approach and the methods. You don't have a lot of space to write the same thing over and over again. So say it if you can in as brief a way as you can, particularly in the literature review. And I know this kind of goes against sort of what you've learned in some ways, but as you get more senior and more experienced, you realize that you don't need 6 sentences to prove that you know that this is a fact. And you'll find that you can say less and be just as effective. And then I'd say the other thing you really need is some evidence of productivity. So it would be things like publications in good journals. As a junior person, and depending on what mechanism you're applying for, you don't need preliminary data, although preliminary data can be helpful. But the idea is that reviewers want to know that you will disseminate your work. That's the bottom line, because remember, they're deciding whether this money that would be given to you to do this work would get out there and inform science and the public. So let's talk a little bit, let's talk a little bit about significance. The significance section is probably the most important in some ways, along with the specific aims, because what you're trying to do is convince the reviewers that what you want to do is very, very important. And what you want to do is make it really easy for the reviewers to understand why that's the case. So when I'm reviewing grants and I have to work really hard to figure out, why is this an important question? Why is this significant? That doesn't bode well for the applicant, because the applicant's writing should be such that it's really, really clear why this is an important problem. So it could be that the problem is super important. It could be who you're studying is especially important. You want to sort of identify why a solution is missing to that particular question. So you don't want to just repeat the wheel, right? You want to be able to say, we don't know this, and this is what people have tried, but now we have these gaps in the literature and we need the solution now. So you want to be clear about why is the solution needed now. So you might want to study some question that was important 10 years ago, but we kind of know the answer to those questions now. So for example, in the area of HIV, we know pretty well that knowledge doesn't change, that increasing knowledge doesn't really lead to behavior change. There was a whole generation of interventions focused on increasing knowledge about HIV. Well, that was important. It led to some important information, but we now know that that doesn't change behavior, that you have to do other things. We also know that probably individual behaviors are not sufficient to sustain behavior change, right? Just using condoms is not necessarily going to lead to sustained behavior change or reduction of disease in the epidemic. That there are structural factors that are really critical that influence whether people take their medicines, whether it's food security or spirituality, or whether it's, living in poverty, whether it's, needing to do sex work because you've got to pay for your kids to go to school, whether it's not having tampons or maxi pads so you can't even go to school if you're a young woman. All those things are impactful now. So just studying knowledge isn't going to be enough, or just trying to increase knowledge. And I would argue that some of our theories of HIV behavior change, change related to HIV risk, are also needing to be a little bit updated, and that some of the early models that only focused on knowledge and attitudes are sort of outdated. So what I'm trying to say is, for you when you think about where's the significance of your study, you want to really think about what do you need to know today, given everything we already know and everything we've already tried. Again, you don't want to do an entire literature review. It's not necessary. You want to focus on the issues that are relevant to your particular project. And many times, what I've seen when I look at grant proposals or when I edit proposals by my mentees and so forth is the temptation to cover the whole literature. But what that does to the reviewer is it's misleading, because you think then that the study is going to focus on all of those topics when in fact the study is going to be about a specific issue. So let's say you start talking about all the factors that influence HIV risk, and you start going into families and peers and structural issues, but your study is only focusing, let's say, on romantic relationships. If you put all that into a literature review, what's misleading about it then is the reviewer thinks you're going to talk about study the rest of it, and is going to be left wondering, well, so what about these other issues that you said were not well understood? So again, what have people tried, and why is a solution important today? So then I think what you want to be able to say is part of your significance is why you and your investigative team have the solution to this problem. And in particular, you're drawing on your own previous experience. There may be ways that you talk about your investigative team, that one person brings experience in individual behavior change, another person brings experience in structural changes to the environment that influence HIV risk, and so forth. So you want to leave the specifics for later in the application, but you want to present in your significance sort of in broad terms why you and your team are the best suited to carry out this project and reach a solution to the problem that you've identified is so highly significant, we must study it now. Oftentimes what you will have is you will have a series of specific aims, which I'm sure you've already discussed, and you're going to talk about how the various aims of the very specific aims are addressing the problems you want to solve. So if, let's say, you're saying that in my particular work, I do work with youth and families around HIV primary prevention mostly, although I have done medication adherence studies. And the idea would be I would want to say that right now what we need to do is understand why rates of HIV seem to be higher in African American women, for example, especially young women, ages 15 to 19 or so, that they're kind of a current key population that we're talking about both in Africa and here in the States. And so I might want to say that here's how this particular this particular concern is going to be studied in this particular project that I'm proposing. And then again, why my team is most qualified to solve those problems. You know, so-and-so does research in African American women, another person does research on families, and so forth, so that the team itself comes together as a group to be able to solve the problem. So some other questions to ask yourself as you're looking through this is, does it address a critical barrier to progress in the field? And these are some of the issues that you will see more specifically listed for reviewers to think about as they are evaluating your application. And it's really important that you look at those specific factors that the reviewers are evaluating, because what you want to do is make it super easy for the reviewer to answer these questions. So, for example, you can use the language that's used by the review, in the review process. So, HIV adherence represents a critical barrier to reducing new infections. So I'm using that language, and that if this study is successful, we will understand how to improve adherence among African American women, young women, so that you're using the the language that's used in the RFA or the program announcement, or that you know that the reviewers are using as they evaluate your application. So in addition, you might look at how successful completion of your aims is actually going to move the field forward in certain ways, whether it's going to change the theoretical perspective on your particular question, whether you're developing new methods or technologies. So for example, you were talking about using internet. Someone asked the question about using internet or web-based interventions to address HIV. You know, phone apps, and you may be able to talk about how those, so they're going to change how people study this question. You're going to develop new interventions that potentially are more effective at increasing adherence or improving partner relationships so that condom use is used more frequently, or helping children disclose their HIV status, whatever that is. But you want to be able to say, how will my study lead to a change in the field in some very important way? So this is actually a new requirement for NIH. This is the scientific premise. And I bring it up here because I think it's something you want to make sure that you are thinking about as you're developing your application. And it's something new that many of us old-timers didn't have to address as directly, but you want to make sure you address it directly in your application. So the goal is to ensure that the underlying scientific foundation of the projects is sound. Okay, so how are you going to do that? You can address it under the significance section. You can really think about whether you've provided sufficient justification for your research study. So that may be, the justification may be around the specific population you're focusing on. You know, that HIV's disproportionately impacting men who have sex, young men who have sex with men. There's your justification for, let's say, a population. Or, you know, maybe you're justifying the technology that you're using, or you're justifying an data analytic approach you want to apply in this new area. You want to make sure that you've cited the appropriate work that has come before you that has led to your question. And even if you have preliminary data, that's excellent, although for some of the smaller mechanisms it's not necessary, it's only helpful. You want to make sure that you've identified some of the strengths and weaknesses of work that's already gone on in the field, and that how is your study going to fill such a significant gap? So why is your study important at this stage of the game? So probably, you know, knowing that the treatment cascade and viral suppression has been, is a big issue around HIV adherence. So maybe your study focuses on how to improve viral suppression, since that's the key issue, a key issue we have right now in the field. And just to keep in mind that now reviewers are instructed to factor in this sort of scientific premise as part of their scores for significance and overall impact. So we're going to do an exercise in a second. I just want to remind you of the scoring rubric. Chris has assured me that you guys are familiar with this, that you know that when the reviews happen, reviewers actually score each section of the application according to these criteria. And so that 1 is an exceptional application. I've actually heard people say they only give a 1 if it is so tremendously impactful, groundbreaking, that other than that they don't give a 1. And you can see that that's exceptionally strong with essentially no weaknesses, all the way down to 9, which is poor, very few strengths, but mostly major weaknesses. So what we're going to do next, I'm going to be handing the controls back to Chris in a second. I've prepared 3 statements of significance that I would like you all to evaluate according to this rubric, to assign from a 1 to a 9. Do you think that statement communicates significance? And at what, is it good? Is it excellent? And then I'm going to ask you to discuss and provide some feedback about why that particular statement did or didn't meet your expectations for an exceptional statement of significance and how you might improve it. So let's start with the first one.
Yeah, and we're going to do this a little differently than polls we've done in the past because some limitations of GoToTraining. So I just put in the chat box a URL that I would like you to go to, and you'll see the first question that we're going to be dealing with in that on that website, and just go ahead and vote according to which score you would give it, and then I'll display the results of that particular one, and we'll as Jerry said, we'll discuss it. So go ahead and go to that poll and start your voting. And it might be a good idea for you to raise your hand when you have voted so that I can so far we've got 2 votes, 3, and I'm going to take control and show my screen here so you can see how the poll results are looking so far. Doesn't look like everybody's voted, so we may have give a couple more people an opportunity to vote. Just raise your hand when you voted so I know that everybody has voted. Okay. Not sure if we'll have anybody else vote. Looks like pretty much everybody who's going to vote may have done so. So I'm going to put down all the hands, and this is where we're coming out. Jerry?
Okay, let's discuss for a minute why it seems like the vast majority voted satisfactory or fair. Can someone sort of express why that's the case?
So maybe I should just call on somebody to do that. Candace, I am unmuting you. Go ahead and sending you a video request. Why did you vote? Tell us what you voted and why you voted that way.
Hey, sorry, it's kind of blacked out in here.
There you are.
I did not vote satisfactory or fair. I voted poor. So should I explain that?
Yeah, that'd be great.
I think that family factors is extremely broad, and there are so many factors that could be included in the family that it would be important to designate 2, maybe 3 that are specific factors amongst families. And HIV risk in and of itself is a broad category. We can assume that we know what that means, but it could be anything from PrEP use to condom use to the combination. And so I think it just needs so much more clarity.
And remember that you don't only have a sentence to do this, but reviewers are going to sort of look for the sentence that they can use to sort of put into their review, right? Because one of the things we'll talk about later is, you know, how to make your grant easy for the reviewers to review, and I think that's a really good point. Are we moving on to the next?
Yeah, I didn't intend to do that quite so quickly, but I think we remember where we were. I pressed the wrong button. I'm not sure how to get back. This is the second question. So if you want to continue discussing the first question, certainly please do.
Did anyone have anything else they'd like to add? I'd be interested in the person who said it was, I think, a number very good. I'm not sure who that, I don't know how to do that. I don't want to call people out quite. If you're comfortable doing that, Chris,
yeah,
maybe if someone...
I don't have any way to tell who voted very good, but if they'd like to offer themselves up, we could certainly ask them about their vote. If you voted very good or good, would you raise your hand and maybe put yourself out there to discuss what your thinking was around that particular rating? If you're not comfortable, that's okay, but nobody's volunteering, Jerry.
Okay, well, that's okay. I mean, I was just going to suggest that, there were some reasonable things about that statement, but why don't we move on to the next one?
Okay. So the voting is available at that same URL for the next question. So if you want to go ahead and look at the next question and put in your rating for that particular one, go ahead.
Does it have the whole question? Because on the scoring thing, it doesn't put out the whole question.
Is it not putting out the...
It cuts it off on your slide.
Yeah, I see that, didn't it? I hope it did. If not, we can go...
It did. It cut it off.
That's unfortunate. Let me see if I can give the full question here. That is on slide 8. I wonder why it did that. This is, like I said, this was a little bit new, so we're trying something out here.
So I put it up on my slide.
Put it up on, let me put it up on this end. So here's what we're rating. I'm going to, hopefully you can see that question. I'm going to make it a little bit bigger because it's probably not large enough. Let's make it a, is that the question that we need?
Yep. This study will clarify important barriers and facilitators of HIV prevention program uptake in juvenile justice settings.
So this is the question that you want to go ahead and
score.
Yeah, score. I think we've got one score so far. Others could go into that website and score that particular question. And raise your hand once you scored it. Couple more people that may want to score. Don't have everybody's hands up yet. Okay, I think that may be as far as we're going to get with this.
All right. Do you want to call a couple people out and ask them for their reasoning behind their scores?
Sure. Let's pick on Stacy. Stacy Smallwood, you there?
I'm here.
Great. I just sent you a video.
Can you hear?
Yeah, sure can.
Okay. Let me see. There we go.
Hi.
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 Hi. So I was one of the people who rated it good. There was a little bit more. There were a few more specifics in this one than the last one. There's still a lot. I mean, granted, we're evaluating this based on one sentence, and that's a difficult kind of thing to do. But I felt as though it gave a little bit more context, and understanding that looking at HIV risk in juvenile justice settings with a vulnerable population is an important thing to examine, but still it's not entirely clear what kinds of barriers or facilitators they may even be considering and examining and looking at in this study.
How would you improve that statement?
I'm looking at like important barriers and facilitators is the thing that is getting me, because just saying it that way implies that, I mean, I don't know anything about what barriers and facilitators have already been identified or whether or not there are some novel approaches that have that they want to examine that haven't already been examined in previous research. So I want a little bit more clarity around what kinds of barriers and facilitators they may want to examine, or if this is just some kind of overall exploratory research. I don't really get a good sense of that.
Okay, thanks.
Thanks, Stacy.
Want to ask anyone else?
Yeah. Let's see. How about Jelani? We haven't called on you today, unless you don't have a video camera available. Jelani, are you there? Jelani? We're not getting him through, so let's call on somebody else.
Oh, the person wrote, "I'm here" in the chat room, but maybe they don't have.
Yeah, the audio didn't seem to work for you. I just unmuted you, Jelani, but I'm not sure that we're hearing you. Occasionally we get technical difficulties. I'm not sure if this conversation would do well in a chat box. You're talking, but we don't hear you. Okay, well, let's maybe while we have a conversation with somebody else, you could put in your chat box some of your thinking, and I'm going to call on somebody else. I'm going to call on Candace Crowell. Candace, are you there? You have to unmute yourself because I see you're muted from my end. Can you unmute yourself?
We already asked Candace. Poor Candace, you're getting put on the spot again.
I'm just kind of.
That's not a problem. That's all right. So I ranked this one a 7 because I think it has a little bit more clarity. It's not absolutely clear, but the specificity around HIV prevention program uptake in juvie gets pretty clear about who you're talking to and what you want to happen. But barriers and facilitators are many. So with that, there could be identified two, depending on how much, like what type of research mechanism you're looking for, there can be maybe 1 or 2 barriers, 1 or 2 facilitators to many, depending on what kind of mechanism you're using. And you could be clear about stating those.
Okay, thanks. Should we go on to the next one?
You want to go on to the next one, or you want to call on have me call on somebody else? Or I'm sorry, I just lost you there.
All right.
Yeah.
That's okay. You want to try and let's go to the next one.
Let's go to the next one. Okay, let's do that. So I hope let's see if this entire question. So if you go back to the question URL, are we getting the entire question?
Yes.
Good. Okay. Let's get votes there, and as you vote, go ahead and raise your hand. think we're up to 11 votes. A couple more people may want to vote. We'll see if we can get the last couple or 3 votes. Okay. Gary, I think that's as many as we're going to get.
All right, let's call on some new people.
Okay, yeah, I'll see if I can remember who I've called on and who I haven't.
How about Elizabeth Bowen?
Yeah, Elizabeth, are you there?
Yes, let me try to share the webcam. Hi. Okay, you can see me here, right?
Sure.
Yep.
Okay, great. So I guess I'm the kind of the negative Nelly of the group here. I'm the one who rated this as marginal. And it may just be the context of this that I'm just reading this one sentence here. But I read that and I thought, okay, is this the hypothesis of the study or what? Otherwise, this sentence doesn't really tell me what this particular study is doing. So is this already a given that there's already other research, perhaps, that mobile technology is critical to effectively address adherence among MSM? And then if that is already kind of a given, then I wondered, what does this what's this study going to do to add to that? So that's why, because that wasn't clear to me, that's why I rated it low.
That's good. Maybe I think that's right. I would agree with that. I think you're always, reviewers are always balancing the various aspects of the review criteria. So it's not that you're right and the person who did excellent is wrong. It's what often happens that you'll see is that people weigh things differently about when they see a statement or when they're judging the significance or an impact. Someone may say, you know what, the fact that this study is going to focus on mobile technology with men who have sex with men, that's so important right now that it's worth a higher score. And that's why sometimes when you'll see reviews for your applications, the reviewers don't always agree with one another for that very reason. So keep that in mind. Okay, I think maybe we should move on.
Okay.
You want to give...
No, I'm going to, unless you want
we'll do this.
Yeah, unless you want to call on anybody else, I'll just give control back over to you.
Okay, why don't you give control back over to me. Let me do this. Sorry, it'll take me a second because I have to move some stuff around here. Okay. All right. So now we're going to move on to innovation, and people should feel free. Are there any questions that people have right now about significance that I'm happy to see if I can address?
So I've put everybody's hands down. If you have a question, go ahead and raise your hand and we can call on you, or you can, of course, always put it in the chat box. Catherine, you have a question. Go ahead, Catherine. You're muted right now, so if you'd unmute yourself, and then...
Okay.
Yeah.
Yeah, I do have a quick question just about the scientific premise. You mentioned being explicit about scientific premise, and I'm wondering if you can sort of give an example. So a lot of the things that you listed sort of to me seemed like things that you would include throughout the significance section. So when you say be explicit, is it something that, like, I don't know, is there certain wording that would be helpful to use? I know that it is a newer aspect of what reviewers are looking for, so I just want to be sure that I'm clear about that.
Sure. I think that some of the ways that I've seen it is people will say the scientific premise of this study is,
okay,
just
so
to draw the attention of the reviewer to that specific issue.
Okay.
And I think that in many cases that's true. Sorry, I realize it's getting dark here. I'm sorry, everybody. I'm in France, so I'm going to just turn on the light. 1 second. I hope this helps. 1 second. Hopefully this will be better.
What's the time difference?
Okay.
Is it like 7 o'clock, 8 o'clock?
7 out. It's difference from the East Coast.
Okay.
So 9 o'clock here?
Oh, wow.
Yeah. Okay, so I think with any of the, I think it's a great question, and I think since it's a newer requirement, I'm not sure that there's like a specific way to do it. But like with any section, one of the issues I'll talk about is because you want to make it really easy for the reviewers, it's, you know, what you'll see when we talk about innovation, this study is innovative in at least 5 ways. So that, because remember, what the reviewers are doing is they're reading your application, and they have to write this critique, and they have to list the strengths and the weaknesses, and they have to, so they're justifying what they're saying, right? And so the easier you make it for them to lift sentences. So when you say this study is innovative in at least 5 ways, they can kind of lift that out and put that right into the section of strengths.
Okay.
Now, they may not buy what you said is innovative, and that's happened to me sometimes. I'll review and I'll go, that's not innovative. Why did she say that was innovative? But the easier you make it, and I think with the scientific premise, it's the same kind of issue.
Okay.
So thank you
Thank
for
you
asking.
very much. That's helpful.
Anything else? Okay, let's move on to innovation.
By the way, Jerry, I just in view of the time, I just want to make sure that we've got about probably 20 minutes left total.
Great.
Okay.
That should be fine.
Great. Okay.
Okay, thank you. Okay, so for innovation, essentially there are a number of ways that your study could be innovative. And in some ways you have to be creative as you think about how it's innovative. So, and you want to clearly state it. So like Catherine asked that question, and I think again you want to be very direct with the reviewers. You don't want to make them work hard to figure out how your study is innovative or what's significant about it or what the approach is. So is your study innovative in terms of the theory that it's applying? So will it shift a current paradigm? Maybe like early on, much of the theory in HIV was many of the theories were focused on cognitive factors. So how your knowledge and your attitudes and your beliefs predicted HIV prevention behavior. And so a lot of people have said, oh, I don't think that those factors are sufficient to describe how people decide to use condoms, or how people, have multiple partners and so forth. So will you apply a theoretical perspective that represents some kind of innovation, maybe looking at structural factors and so forth? Now, of course, if there's like a standard way or paradigm of looking at it, you want to make sure that you've provided a reasonable justification for why you're challenging that. A second area, broad area of innovation could be the methods or the approach that you use. Are you using a method that is different than what most people do? So maybe someone's using daily diaries to look at the relationship between spirituality and adherence to antiretrovirals. Is daily diaries an innovative approach to use to look at that question? Or are you studying a research question by using mobile technology in a setting where it hasn't been used previously? So are you doing something new? Are you using new measures to assess a question, a research idea, a theoretical perspective? Are you using, let's say, if you're studying neuropsychiatric associations with HIV, dementia, are you using sort of interesting psychological tests related to attention or impairment? So those are ways that you can state that your approach is innovative. Oops. Oops, sorry about that. I'm having a lot of trouble with this. Okay, so do you have another way that your study might be Innovative is the resources that you have available to you. Maybe you have certain resources at your institution to study certain questions that are innovative that haven't been used before. Another would be the subject population. Is it, you know, maybe this particular question has not been studied in a juvenile justice setting or with Rwandan adolescents or with young men who have sex with men. Are you applying a new intervention to this population? Maybe you're taking an intervention that's been used in the area of diabetes and you're adapting it for HIV. So those could be innovations. Similarly, I would suggest that you may be bringing together an investigative team that's really innovative. You know, maybe they bring different types of multidisciplinary expertise in, you know, someone who's an expert in weight loss, but you're applying it to your new population in relation to adherence to medications. And so I think you can talk about your investigative team as an innovation. And then you can also, of course, talk about the disease focus. And I don't know if there are other thoughts about how you can pitch your study as innovative, but what I would suggest is that you make it really clear to the reviewers what aspects you believe your application addresses that are innovative. Now, this slide is more to do with how NIH defines innovation. So when reviewers are charged with evaluating your application, they're looking at these particular issues in relation to innovation. So again, if you want to make it super easy for the reviewers, you can take this language and you can say things like, you know, the methodologies used to assess this question are novel in the area of HIV, although they've been used in the area of diabetes previously. Or this application represents an improvement in applying HIV prevention interventions with this new population, and so forth. So it's always important when you're writing your applications to be able to take a look at what the reviewer's criteria are, and you make sure that you're linking that with what they are doing, what they have to evaluate. So I have 3 more examples of innovative statements, and I was going to have you score them. Why don't we do that quickly? I'm going to turn it over to Chris.
Okay, we'll do that. So there's a new URL. I'm sorry, I just made that. I accidentally sent that just to one person, and I didn't want to send it to all of you. So this is the new URL that we're going to use for this particular set of questions. And go ahead and start voting, and we will show my screen as we get the poll results in. So if you go to that URL and start voting, and then raise your hand once you've had the opportunity to give your particular score on this innovation question. So far we've had 10 people vote. We just need a couple more votes, I think. A few more votes.
Maybe we can start the discussion about what people think. Maybe you could call on a couple of new folks?
Sure, yeah. Let's see. How about Jillian Baker? Jillian, are you there?
I'm here.
Did you have an opportunity to vote?
I did.
Okay.
And my vote, although I'm usually not that as negative as I think as other people, but I did vote satisfactory for this one. I think there is an assumption of this method being innovative, and we don't really know that. Number two, mobile technology is also broad, so we don't know if it's the use of phone, we don't know if it's a text message, so this could be something that's already been done before. Also, I think MSM in itself is broad too. So this could be young African American MSN, Latino, which then would get to whether this is a population that might need more specific help in terms of adherence. So I think satisfactory. This could definitely be a lot stronger with some more information.
Great. So one of the consistent things we're hearing across all of these is that people would like more specificity, which I think is perfectly fine, and of course it's only a sentence. But one thing you could do if you were trying to give a sentence like this is to put in parentheses exactly what you mean. So, or this study is innovative because we are using text messaging technology to remind young Black MSM to adhere to antiretrovirals in order to achieve viral suppression. So something like that might be more comprehensive and provide a little bit more detail about what you'd like to see. Let's go to the next one.
Want to go to the next question?
Yep.
Okay. So the same place to vote, same URL to vote on, and this is the new question. Put everybody's hands down. So if you would go ahead and start your voting, we'll see how this one turns out. We have 10 votes. We probably could get, there's 11. We've had up to 13 in the past, so there may be a couple of people that are holding back their opinions. So maybe.
Okay, well that's enough. Let's just see what someone has to say.
How about Karen? Karen, are you there? If you are, you're muted. If you could unmute yourself, Karen, and.
Hi, how are you?
Hi.
Can you listen? Can you listen to me?
Mm-hmm.
Yes, that's great.
I vote for because I think there is a lot of information. For example, I don't know what is a new population and what is the evidence base that the researcher is referring in the sentence. So I don't know if the methodology is innovative.
Okay, good. So again, I think in general what most of you are saying is you want a lot more specificity in the statements, which, you know, keep in mind that you have the opportunity to provide that information throughout the paragraph that you might use to describe innovation or significance. Chris, I think I'm going to skip the next one and move on to some, you know, my general points and then open it up for questions.
That sounds great. So I've just given control back to you.
Okay, let me do this.
Great.
Get rid of this. So I just wanted to provide some general tips. I know it's not exactly what I was asked to do, but it's hard to do a talk like this and not give some of the general tips that I know are super important when you're writing grants. So I've said this a number of times, making the reviewer's job easy. So providing summary statements that they can easily cut and paste into the review. So in sum, the significance of this project is blah, 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 blah. In sum, or this, you know, the innovation of this project is the following. So you want to allow them so they can easily, because I'm sure you've talked about this already, the reviewers who look closely at your application present to the review panel. And you want to make it easy for them to advocate for you, because essentially what happens is one of your reviewers is going to have to take on your application and say, this is such a good application and here's why. So you want to help them in advocating and summarizing your study. So listing the ways that it's innovative, talking about what summary statements they can use to present. Also to take advantage of senior collaborators where you are. Go to people who do not be shy to ask senior investigators to collaborate with you. Put out a request and say, I'm doing a project on such and such, because at this stage of the game, you will be much more effective if you have engaged senior people who really want to help you, and they really want to help you get funded, and the reviewers see a senior person on that application and say, oh, you know, that's great. She'll make sure that this really gets done well. And then another idea, another sort of general tip is to make sure that you call the program officer, identify which institute makes most sense to apply for your particular study. Talk to the program officer to gauge their interest in your project. I actually know of a study that got an excellent score, but the institute had no interest in funding it. It wasn't one of their priorities, so it never got funded. So it's always important to engage the program officer in your project. In addition, creating a seamless application where you have very clear linkages between each of the sections. So if you say your aims, you have your 3 specific aims. Your methods need to match those aims, and then your data analysis section needs to address each of those aims and how you're going to address each of those aims. Also, make sure you ensure that it's well written in terms of punctuation and grammar. If any of you need help making that the case, please don't hesitate to ask people to review it for clarity. It's really important because the reviewers don't want to have to work really hard to read the application. And I know that both from, I've probably sat in on over 50 study sections. I've been a member of a study section for many years. I sat in on many different special emphasis panels. People get frustrated when they feel like they have to work really hard to read and understand the application because they feel like they're working harder than you did to actually write it. So graphs and pictures can be helpful, but make sure that they're relevant. Be consistent across the application. So if you say your sample size is 350 in the abstract, make sure it's still 350 in the aims, and then it's still 350 in the approach. It's also helpful to repeat some of the more important concepts. For example, the impact of this study is critical given the stage of, this phase of the epidemic. We need to really understand these questions given that this particular population is disproportionately affected, and so forth. So repeat those in the different sections so you're keeping the reviewer's mind on why your study is important. And remember, sometimes reviewers don't read the whole application in one sitting. They might read the specific aims, then they may go make dinner for their family, then they come back and read the background and significance, then they go to bed, and then they wake up the next morning and they read your approach. So the ways that you can kind of create a seamless application for them and help them remember the most important points is going to be very helpful. I find using theory to drive your research question is critical because at this stage, many factors can influence your outcome. I think we've talked about that already in a couple of examples here, that your outcome could be adherence to antiretroviral medications. Well, we know that there are many factors that might influence that, but you want to identify why the factors you're planning to study, because it can't be exhaustive, why those are important. And theory can often help you do that. You use a theory to guide that, and then you can identify which factors are most important. Make it easy to read and be organized. This is just a note about the difference between impact and significance, which I think you want to make sure that you really pay attention to, because remember, overall impact is the main score that you will get at the end of the review. That will show you, your specific reviewers will give you scores at each of the different components of your application, but overall impact is your final score that drives whether you will be funded. So make sure you pay careful attention to the difference between whether your project will exert a sustained and powerful influence on the field versus does it address an important question, which might be, you know, a critical barrier or some kind of change relative to the field. So just a couple more slides. Common reasons for a weak application. The reviewers will say the impact isn't particularly clear, or it's weak, or the significance isn't obvious. A lot of times, especially for junior investigators, the concern will be that it's too ambitious or that it lacks focus, because people include all the variables that might be important, but you can't really study that. You really have to be focused. So you might have a flawed hypothesis, you might have a weak track record. They may say, well, that's all good and interesting, but I don't know that she's the person who could really carry this out because she hasn't published in this area, or no one on her team has done an intervention study, or there, you know, it's problematic that no one has worked with adolescents in that group. Feasibility isn't supported. That would be a little bit more for the R01, but you still want to be able to demonstrate that even if you're only going to recruit 20 participants for focus groups, that you have access to the population that you want to study and that you can carry out the project. Outstanding applications, sort of similar, a very strong significance, a clear rationale. You've stated and convinced the reviewers that this is an important problem in public health. With high impact, it's novel and it's innovative, and you have a strong track record. It's a clear and focused approach, so you know what your endpoints are and your predictors and your outcomes, and it's clear how they're related to each other, and it's consistent throughout the application. So I'm going to stop there and just see if people have any questions or concerns or would like to address anything at this point.
We are right up against the end, so we'll see if anybody has any questions, and maybe we can take one. If anybody has a question, you can go ahead and raise your hand. If it's okay, we'll make your slides available on in our library for people.
Sure.
And sometimes people do contact me later. They wake up in the middle of the night and they have a question that they didn't have when the talk was going on. And so I hope it's okay if I email you any questions that come in along. May come in later.
Sure.
Great.
Or people can email me directly too. Feel free to do that and email me if you want to have a conversation about something that I've commented on.
Okay. Well, then with that, I'm going to put the homework up for next time, and our next presenter will be Parker Palmer, who is one of the people in the sponsored programs department at Vanderbilt. And this person is an expert on budgets and financial justifications and the such. So I think this will be an excellent presentation. And in advance of that, we're asking that you begin to look at developing a budget and begin to take a stab at developing your own budget. Talk to your mentor about it as well. This is a really important part of your application. And your university will really, I think, be happy that you've begun to have some conversations with people that are experienced from sponsored programs. So that will be in 2 weeks. We look forward to seeing you then. Dr. Donnenberg, thank you again for taking time out of your vacation. As you're in France right now, we so much appreciate your wisdom and insights on this, and I know all of our people do as well, so thank you very much.
It was my pleasure. Thank you for having me.
Absolutely. If you'd stick around for just a couple minutes after everybody leaves, we just kind of do a quick debrief. So as people drop out, thank you, everyone. Bye-bye. And if you need anything from me in the meantime, just pop me an email. Thanks. Have a good afternoon. Enjoy your weekend.